Discover how diabetes can impact your nerve health and uncover the surprising power of vitamins in managing these effects. If you're living with diabetes, learning which vitamins boost nerve health can be a game changer. In today's video, we'll delve into 6 key vitamins that support your nerves, offering you an easy path to better manage your condition. Top 6 vitamins that support nerve health in diabetes. Number 1, vitamin B12. All right, kicking things off at number 1 is vitamin B12. You might also know it as cobalamin, and it's a real powerhouse nutrient, absolutely vital for nerve function and for the formation of myelin. That's the protective sheath that covers your nerve fibers. Now, for those living with diabetes, keeping those B12 levels adequate is especially important. This is because some diabetes medications, like metformin, can actually interfere with its absorption, and that could lead to a deficiency. And a deficiency in B12? Well, that can make symptoms of diabetic neuropathy worse, or even mimic them. Things like tingling, numbness, and even difficulty with balance. You know, research has consistently pointed to the link between B12 deficiency and nerve damage. Studies have shown that supplementation can actually help improve symptoms of diabetic neuropathy in people who have low levels. For example, a study that was published in the Journal of Diabetes Investigation found that B12 supplementation improved nerve conduction velocity and also reduced pain scores in diabetic patients with neuropathy. And there's another line of research suggesting that B12 might even help regenerate nerve fibers and reduce oxidative stress, which is a key factor in nerve damage. So how does vitamin B12 actually work to support nerve health? Well, its mechanism is quite multifaceted. It plays a critical role in making something called S-adenosylmethionine, or SAMe. This compound is involved in essential methylation reactions that are needed for maintaining that myelin sheath we talked about. And healthy myelin means your nerve signals can transmit rapidly and efficiently. What's more, B12 helps convert homocysteine into methionine. This is important because elevated homocysteine levels are linked to an increased risk of both vascular damage and neuropathy. When it comes to getting vitamin B12 from your diet, you'll find it primarily in animal products. Think things like meat, especially liver and beef, poultry, fish like salmon and tuna, eggs and dairy products such as milk, cheese, and yogurt. Now, if you're following a plant-based diet or have some absorption issues, fortified foods are good options. These include certain breakfast cereals, plant-based milks, and nutritional yeast. Sometimes supplementation might be necessary, particularly for those on metformin or if a deficiency has been diagnosed. And it's really crucial to talk to your healthcare provider to figure out the right dosage and form of B12 for you, as this can range from oral supplements to even injections if the deficiency is severe. Number 2, vitamin B1, thiamine, and benfotiamine. Moving on to vitamin B1, which you might know as thiamine. This is another absolutely essential nutrient for your nerve health, playing a key role in how your nerve cells get their energy. You see, nerves need a good deal of energy to function correctly, and thiamine is crucial for converting carbohydrates into this usable energy. In diabetes, where glucose metabolism is already a bit off, thiamine's role becomes even more critical. If you don't have enough, it can lead to a buildup of harmful byproducts from glucose metabolism, and those can unfortunately damage your nerves. Now, there's a specific form of thiamine called benfotiamine, which is a synthetic, fat-soluble version, and it's been getting a lot of attention when it comes to diabetic neuropathy. Because it has enhanced bioavailability, benfotiamine is absorbed more effectively by your body and can reach higher concentrations in your tissues compared to the standard water-soluble thiamine. Research actually indicates that benfotiamine can help prevent the progression of diabetic complications, including neuropathy, because it blocks several pathways of damage caused by high blood sugar. For instance, studies published in journals like Diabetes Care have shown that benfotiamine supplementation can improve nerve function and reduce neuropathic pain in people with diabetes. So how do thiamine and benfotiamine actually protect your nerves? Well, it involves several pathways. They activate an enzyme called transcatalase, and this enzyme helps to redirect excess glucose away from pathways that produce harmful things called advanced glycation end products, or AGEs for short. These AGEs are a major contributor to nerve damage in diabetes. So by reducing the formation of these AGEs and decreasing oxidative stress, these B vitamins help protect your nerve cells from damage and support their proper function. And benfotiamine is particularly effective here because it can penetrate cell membranes more easily. If you're looking for good dietary sources of thiamine, think whole grains, pork, nuts, seeds, especially sunflower seeds, legumes like beans and lentils, and also fortified cereals and breads. Now, while benfotiamine itself isn't naturally found in foods, eating thiamine-rich foods definitely supports your overall B1 levels. For those therapeutic effects related to diabetic neuropathy, benfotiamine is usually taken as a supplement. And, as always, if you're considering supplementation with either thiamine or benfotiamine, it's really important to discuss this with your healthcare provider. They can make sure it's appropriate for your specific situation and help determine the correct dosage, because everyone's needs can vary. Number 3, vitamin B6. Next, we have vitamin B6, also known as pyridoxine. This vitamin is essential for so many metabolic processes, including the creation of neurotransmitters. Those are the chemical messengers that transmit signals between your nerve cells. Its role in keeping your nervous system healthy is really well established. And for individuals with diabetes, having adequate vitamin B6 levels is important because it actually helps regulate blood sugar levels and is also involved in producing hemoglobin, which is what carries oxygen to all your body tissues, including those vital nerves. Now, research does suggest that a vitamin B6 deficiency can contribute to neuropathic symptoms, and some studies have looked into its potential benefits for managing diabetic neuropathy. It's interesting because while very high doses of B6 can paradoxically cause nerve damage, having the appropriate levels is crucial for nerve protection. Some studies indicate that B6 might help ease symptoms like pain and tingling for certain individuals with diabetic neuropathy, possibly by improving nerve conduction and reducing inflammation. However, it's fair to say the evidence isn't quite as strong as it is for B12 or benfotiamine, and more research is really needed to pin down its precise role and the best dosage in this situation. So, how does vitamin B6 work its magic on nerve health? Well, it does so through several mechanisms. It acts as a cofactor for enzymes that are involved in creating key neurotransmitters like serotonin, dopamine, and GABA. All of these play roles in how we perceive pain and in our mood, which, as you know, can often be affected in chronic conditions like diabetes. In addition to that, vitamin B6 is involved in the metabolism of homocysteine. Just like B12 and folate, it helps keep those homocysteine levels in check, which is great for both your vascular and nerve health. And it also chips in to help form that protective myelin sheath. Looking for vitamin B6 in your food? Excellent dietary sources include poultry like chicken and turkey, fish such as salmon and tuna, potatoes and other starchy vegetables, non-citrus fruits like bananas and avocados, and also fortified cereals. Organ meats are also very high in B6. Now, while most people do get enough B6 from their diet, supplementation might be considered, but it should be under medical supervision, especially if a deficiency is suspected or if there are specific therapeutic goals in mind. It's really vital to avoid taking too much, as high doses of B6, typically above 100 to 200 milligrams per day for extended periods, can actually lead to peripheral neuropathy. So always consult your doctor before starting any new supplement. Number 4, folic acid, vitamin B9. All right, we have folic acid, which is the synthetic form of folate, or vitamin B9. Folic acid is really well known for its role in cell growth and development, and that makes it absolutely essential for maintaining healthy nerve cells. It actually works very closely with vitamin B12 in several metabolic pathways, including DNA synthesis and repair, which are critical for the integrity and regeneration of your nerve cells. So, for people managing diabetes, ensuring you have adequate folate levels can be a really important part of a comprehensive nerve health strategy. Several studies have actually looked into the connection between folate levels and diabetic neuropathy, and the research indicates that low folate levels might be associated with an increased risk of neuropathy and also more severe symptoms. Supplementation with folic acid, often together with vitamins B12 and B6, has shown some promise in certain studies for improving nerve conduction and reducing homocysteine levels. And we know that homocysteine is a risk factor for nerve damage. For example, a meta-analysis that was published in the American Journal of Clinical Nutrition suggested that B vitamin supplementation, including folic acid, could have a positive impact on endothelial function and reduce homocysteine, which would indirectly benefit your nerve health. So, how does folic acid support your nerve health? Well, its mechanisms are quite intertwined with those of the other B vitamins. It plays a crucial role in something called the 1-carbon metabolism pathway. This pathway is essential for the methylation processes that are necessary for myelin formation and for keeping your DNA stable. And by helping to convert homocysteine to methionine, folic acid reduces the levels of this harmful amino acid, which, as we've mentioned, can damage blood vessels and nerves. Adequate folate also supports the production of nitric oxide. Nitric oxide is a molecule that helps relax your blood vessels and improve blood flow to the nerves, making sure they get enough oxygen and nutrients. If you're looking to get more folate from your diet, rich sources include leafy green vegetables like spinach, kale, and collard greens. Also, asparagus, broccoli, beans, peas, lentils, avocados, and citrus fruits are great. In many countries, a lot of grain products like bread, pasta, and cereals are fortified with folic acid. Now, while a balanced diet can provide enough folate for many people, individuals with diabetes or those who have increased needs might benefit from supplementation. And just like with the other vitamins we've talked about, it's always best to discuss folic acid supplementation with your healthcare provider. They can help determine the right dosage for you and make sure it fits in with your overall diabetes management plan. This is especially important because folic acid can sometimes mask a vitamin B12 deficiency. Number 5, vitamin D. Next up is vitamin D, often called the sunshine vitamin. Now, it's primarily known for its role in bone health, but there's emerging research that strongly suggests it also plays a really significant part in nerve function and protection. It turns out that many individuals, including those with diabetes, are found to have insufficient or even deficient vitamin D levels. And this deficiency has been linked to an increased risk and severity of diabetic neuropathy, which really highlights how important it is to maintain adequate levels of vitamin D. There have been numerous studies exploring the association between vitamin D status and diabetic peripheral neuropathy. In fact, a systematic review and meta-analysis published in Diabetes Research and Clinical Practice found a significant link between low vitamin D levels and an increased risk of diabetic neuropathy. Some intervention studies even suggest that vitamin D supplementation might improve neuropathic symptoms, like pain and balance, and could potentially enhance nerve conduction in individuals with diabetes who have low vitamin D levels. Researchers think it might help by reducing inflammation and oxidative stress, both of which are known to contribute to nerve damage. The ways in which vitamin D supports nerve health are quite multifaceted, and scientists are still working to fully understand them. It's thought to have what are called neurotrophic effects, which means it can support the growth and survival of your nerve cells. Interestingly, vitamin D receptors are actually found on nerve cells, which suggests it plays a direct role in nerve function. Beyond that, vitamin D has potent anti-inflammatory properties and can help regulate your immune system. This is really beneficial because, as we know, inflammation plays a key role in the development of diabetic neuropathy. It might also improve glycemic control and insulin sensitivity in some individuals, which would indirectly benefit nerve health too. So, where do we get vitamin D? Well, the primary source is sunlight exposure, as our skin actually synthesizes it when exposed to UVB rays. However, things like your geographic location, the season, your skin pigmentation, and even sunscreen use can limit how much your body produces. Dietary sources are relatively few, but they do include fatty fish like salmon, mackerel, and sardines, as well as cod liver oil, egg yolks, and fortified foods such as milk, yogurt, orange juice, and breakfast cereals. Given how common vitamin D insufficiency is, many people with diabetes may actually require supplementation. A simple blood test can determine your levels, and then your healthcare provider can recommend an appropriate supplement dosage to help you achieve and maintain optimal levels for both your nerve health and your overall health. Number 6, vitamin E. And finally, we have vitamin E. This is a powerful fat-soluble antioxidant, and it plays a critical role in protecting your cells from damage caused by oxidative stress. Oxidative stress, as you may know, is a major contributor to the development and progression of diabetic neuropathy. Your nerve cells are particularly vulnerable to this kind of oxidative damage because of their high metabolic activity and their lipid-rich membranes. So, by neutralizing harmful free radicals, vitamin E helps maintain the integrity and function of these important cells. Researchers have definitely investigated the potential of vitamin E supplementation in preventing or easing diabetic neuropathy. Some studies suggest that vitamin E can improve nerve conduction velocity and reduce symptoms of neuropathy in individuals with type 2 diabetes, especially when it's combined with other antioxidants or B vitamins. For instance, a study in the journal Diabetes Care indicated that long-term vitamin E supplementation might actually have a protective effect against the development of neuropathy. However, it's fair to say that the results have been a little mixed, and more research is still needed to establish really definitive guidelines. The main way vitamin E works for nerve health is through its antioxidant capacity. It actually integrates itself into cell membranes, protecting them from something called lipid peroxidation. This is a process where free radicals attack lipids, leading to cell damage. And this protection is particularly important for that myelin sheath around your nerves, which is rich in lipids. So, by reducing oxidative stress, vitamin E can help improve blood flow to your nerves and support their regeneration and function. Plus, it also has anti-inflammatory properties that can further contribute to nerve protection. If you're looking for good dietary sources of vitamin E, think about nuts like almonds and hazelnuts, seeds such as sunflower seeds, vegetable oils like sunflower and safflower oil, wheat germ, spinach, and broccoli. Avocados also provide a decent amount. Now, while getting vitamin E through a balanced diet is always ideal, supplementation might be considered, especially if your dietary intake is low or if there's evidence of increased oxidative stress. But it's really important to consult with a healthcare professional before taking vitamin E supplements, as high doses can interfere with blood clotting and can also interact with certain medications, such as blood thinners. Choosing and using vitamin supplements, safety and efficacy. Now, it's really important to talk about choosing and using vitamin supplements safely and effectively. While these vitamins can definitely play a supportive role in managing nerve health when you have diabetes, it's absolutely crucial to approach supplementation wisely. Not all supplements are created equal, and how well they work can really vary. So always prioritize getting your nutrients from a balanced diet. That should be your foundation. If you are considering supplements, please consult your healthcare provider or a registered dietitian. They're the ones who can help determine if you actually have any deficiencies, recommend the appropriate dosages for your specific needs, and, very importantly, ensure that any supplements you take don't interact with your current medications or health conditions. And always remember, supplements are meant to complement, not replace, your medical treatment and a healthy lifestyle for managing diabetes. So, to wrap things up, supporting your nerve health is truly a vital aspect of managing diabetes effectively. While maintaining good blood sugar control is absolutely paramount, that's number one. Incorporating these 6 key vitamins we've discussed today, B12, B1, and its form, Benfotiamine, B6, Folic Acid, vitamin D, and vitamin E, whether it's through your diet or through carefully considered supplementation, can provide that valuable additional protection and support for your nerves. And if you found this information helpful today, we'd be so grateful if you'd share it with others who might also benefit. We'd also love to hear from you, so please feel free to ask any questions you might have or share your own experiences in the comments section below.